There's a number of reasons that people get knee arthritis or knee osteoarthritis, and there's a few things you can do to try and avoid making sure that you don't get knee arthritis. But it's important to remember that there's some things that are outside of your control, and I don't like patients feeling that it's their fault when they get knee arthritis. A big component of knee arthritis is genetic, and sometimes it runs in families, and it can be difficult to avoid if it's within your genes. One of the key factors that we see that can contribute to a higher likelihood of getting arthritis is being overweight. If you're outside of your ideal body weight, then more force goes through the knee and through the cartilage surfaces, and therefore we're more likely to see premature wear. So staying within your ideal weight can be absolutely critical in terms of reducing your risk of developing arthritis. We also believe that smoking carries a risk of increasing arthritis. We know that the effects of smoking impair your body's ability to heal itself and repair itself from the daily damage, and we think that that's why we see more knee arthritis in smokers. Another subgroup of arthritis comes with injuries, particularly injuries to the shock-absorbing cartilages inside the knee called the menisci. And so we often see a higher incidence of arthritis in people that have had knee injuries in younger life. That can be sports-related injuries such as twisting and tearing a cartilage, or it can be fractures or broken bones around the knee where the fracture lines extend into the knee. It can be more difficult to avoid these sorts of things, but if you've been unlucky enough to have an injury like that, you may choose to change your lifestyle a little bit in order to try and prevent getting knee arthritis in later life. Finally, there's some factors in the diet which have been scientifically shown to be of benefit. Fish oils in particular are supposed to be good for patients suffering with the symptoms of arthritis, and it is probably a reasonable idea to have a diet high in natural oily fish. There are some other health food supplements which have been shown to be helpful with the pain of arthritis, such as glucosamine, and often when I see patients with early arthritis, I will recommend that they try this and see if it helps them. But it's important to remember that there are some factors outside of our control, and they're genetic factors, and that as an arthritis patient you shouldn't necessarily blame yourself. And I always like to emphasize that to my patients.